We are glad you are back for another episode of Weekly Health News. We offer you the most recent news and developments each week about health and wellness. Here is a lowdown on new medical developments, healthy lifestyle advice, and everything in between. Here is a quick recap of the top news of the week that went by. From 4th of March to 24th of April 2023, 3 human cases of infection with influenza A H9N2 viruses and 2 human cases of infection with influenza A H1N1 variant viruses were reported officially. For those who want a reminder to hit the gym daily, a new study published in a medical journal states that older men with exercise habits in both adolescence and older age were at a lower risk of sarcopenia, low muscle mass, and low muscle performance, whereas older women with exercise habits at both time periods were at a lower risk of low muscle performance. Who doesn't love French fries? But a new study says that reaching for fried foods may have a negative impact on mental health. A research team in China found that frequent consumption of fried foods, especially fried potatoes, was linked with a 12% higher risk of anxiety and 7% higher risk of depression than in people who did not eat fried foods. Another Indian cough syrup is marred by controversy. The World Health Organization has said that a batch of contaminated India-made cough syrup has been found in the Marshall Islands and Micronesia. The World Health Organization said that the tested samples of Guaianacia TG syrup made by Punjab-based QP Pharmachem Limited showed unacceptable amounts of diethylene glycol and ethylene glycol. The World Health Organization statement did not specify if anyone had fallen ill. Another study has claimed that ones who experience childhood adversity are prone to develop type 2 diabetes in early adulthood. The study was published in the journal Diabetologia. A new study published in the journal Cell Metabolism found that the biological age of humans undergoes a rapid increase in response to diverse forms of stress. However, it was also found that it can be reversed when the tension eases. A landmark study has shown that losing weight can keep type 2 diabetes at bay for at least 5 years. Around a quarter of people in remission from diabetes 2 years after starting a low-calorie diet were still in remission 3 years later, according to data. An interesting new study has found that cranberries can reduce risk of UTI for women, children, and for people susceptible to UTIs after medical interventions. What if we told you that simple calorie counting can cut down your cancer risk? A new study published in the journal BMJ Open found calorie counts have prevented at least 28,000 cancer cases linked to obesity and 16,700 cancer deaths over a lifetime, while saving a staggering $2.8 billion in healthcare and societal cost. A study has found that abnormal sleep patterns disrupt the body's natural biological clock and have been linked to lung health issues. The study was published in the journal Nature Communications. Researchers have shown how a biological clock molecule contributes to lung scarring, uncovering new potential drugs and drug targets along the way. A fatal effect of AstraZeneca's COVID vaccine has been reported by the NY Times, quoting a report released by a London coroner this week. In this highly rare case of a fatal reaction to the vaccine, Dr. Stephen Wright, a 32-year-old psychologist, developed blood clots 10 days after getting the first shot of the said vaccine. He died on 26th of January 2021. Jean Tyler, 75-year-old from South Shields, who was part of a study using artificial intelligence to detect bowel cancer, is free of the disease after it was found and removed. In the trial, the AI flags up tissue potentially of concern to the medic carrying out the colonoscopy, which could be missed by the human eye. Before we end this episode, it's important to remind you that COVID cases continue to rise in the country, so do not let your guards down. Stay at home if you feel unwell and mask up in public and crowded places.